Hi, I'm Brianna Eslick, and I'm doing a head, eyes, ears, nose, and throat exam here today for Nursing 383. I'm first going to go into the room and do hand hygiene and introduce myself to the patient. Hi, I'm Brianna. Hello. And I would normally do a general assessment first, but I'm not going to do that today. And I'm going to start off by checking her skin. We're going to go over that, and by just first inspecting, making sure there's no lesions, bumps, or bruises or anything that I can see and everything looks normal. And then I'm going to palpate and feel her skin. Everything is warm, clean, dry, and intact here. There's no deformities at all. And then I would look at her nail beds and look at the color and the shape of her nail beds there. Everything's normal. Then I'm going to go on to the head, and I'm going to inspect her head. I do have to move her hair around a little bit to inspect her scalp to make sure everything looks okay. And then I'm going to go on to palpating her head and feeling. And I'm going to make sure there are no deformities. I'm going to feel for symmetry and distribution, and that everything is dry but not too dry or flaky. And then I'm going to go onto her face and feel her facial bones here. Everything is symmetrical. And then we're going to feel her sinuses, her frontal sinuses here, and her maxillary sinuses here. And everything feels normal there. Next, I'm going to go on to and continue with her feeling her face, and I'm going to feel her temporal arteries on both sides and compare those. And then I'm going to go on and assess her TMJ. Here at your jaw, I need you to open your mouth and then close it. And we're feeling for a click, but there was none there, so that's good. Next, I'm going to go onto the eyes and inspect her eyes. I'm going to inspect and kind of feel her lids here and look at her eyelashes, and they're evenly distributed there. And then I'm going to pull down, you can have your eyes open, and look at the conjunctiva, and it looks normal there. And then I will look at the iris and the sclera, and everything is symmetrical with her eyes, and there's no yellowing or jaundice of her sclera at all. Next, I'm going to move on to the ears. And I'm going to compare the sides, but I'm going to look at the external ear and inspect and palpate it, kind of pulling it, and there's no tenderness there, right?
Nope.
Nope. All right. And then I'm going to compare that, the auricle, to the other side also. And that is symmetrical there. All right. Next, I'm going to inspect the nose. I'm just going to look at it, and it's symmetrical with her face. It's in the center. And then I'm going to palpate, make sure there's no tenderness or deformities there, and that's normal. And then I'm going to have you look up, and I'm going to look into your nostrils, make sure that there's normal patency, and look at her septum that's not deviated there. And then I'm going to have to check nasal patency, and I want you to close one nostril and breathe in and out. And then close the other nostril and breathe in and out. And that is normal, so she has normal airway patency there. All right. And then next, I am going to look at the mouth, and I'm first just going to inspect her lips and around her mouth. Everything's normal, and she has normal pink-red lips. Then I'm going to look inside, and I would normally be wearing gloves, but I would look at her gums and make sure everything is normal with no tearing in there. And that looks good, and her teeth look good. And then with her mouth open still, I'm going to be looking at her oral mucosa, which is nice and pink and moist in there, which is good. And then I'm going to have her open your mouth, and you can say ah for me.
Ah.
Good. And I was looking at her uvula, which is midline and symmetrical, and her tonsils moved when she said ah, and I would grade them a +1. And then I'm also just going to look under your tongue and make sure everything is connected and intact. We're good there. Next, I'm going to move on and palpate the nose. First, I will palpate the preocular and the postocular, then the tonsilary node here, and the submandibular node and the submental node. And then I'm going to do the anterior cervical and the posterior cervical. Those are all normal. And then I'm going to have you shrug your shoulders just a little bit, and I'm going to feel for the supraclavicular nodes, and I can't feel any there, so that is good. And then lastly, I'm going to inspect her trachea just by looking at it, that it's midline and centered and symmetrical, and feeling that there is no enlargement of the thyroid or anything there. So everything looks good, and we are finished. Thank you.